What is chronic kidney disease? Chronic kidney disease, or CKD, occurs when your kidneys slowly lose their ability to filter waste and excess fluids from your blood. Your kidneys act like your body's cleanup crew, removing toxins and balancing electrolytes and fluids, which are then excreted in your urine. When they're damaged, waste builds up, leading to imbalances that can cause serious health issues. Chronic kidney disease is often called a silent disease because symptoms may not appear until the condition has significantly progressed, making early detection important. Globally, CKD ranks among the top 10 causes of death and disability, particularly in low- and middle-income countries where late-stage diagnosis is common. Causes and risk factors of chronic kidney disease. What causes chronic kidney disease? The leading causes are diabetes, both type 1 and type 2, which accounts for nearly 44% of new cases, and high blood pressure, also known as hypertension. Uncontrolled blood sugar from diabetes damages blood vessels in the kidneys, while chronic high blood pressure narrows or weakens them, impairing kidney function. Other causes include glomerulonephritis, an inflammation of the kidney's tiny filters called glomeruli, and polycystic kidney disease, a genetic disorder causing fluid-filled cysts in the kidneys. Urinary tract obstructions, like kidney stones, tumors, or an enlarged prostate, can also harm the kidneys. Additional risk factors include being over 60, smoking, obesity, having a family history of kidney disease, or prolonged use of non-steroidal anti-inflammatory drugs, like ibuprofen, which can damage kidneys when overused. Signs and symptoms of chronic kidney disease. Because CKD is a silent disease, you may not notice symptoms in the early stages. As it progresses, waste buildup and fluid retention can cause a range of issues. You might feel fatigued or generally weak, notice swelling in your legs, ankles, feet, or hands, known as edema, or need to urinate more often, especially at night. Other symptoms include shortness of breath, nausea, vomiting, loss of appetite, persistent itching, muscle cramps, difficulty concentrating, and high blood pressure that's hard to control. Many of these symptoms stem from waste accumulation, electrolyte imbalances, or anemia, a common CKD complication where the kidneys don't produce enough erythropoietin, a hormone needed for red blood cell production. Stages of chronic kidney disease. Chronic kidney disease is divided into 5 stages based on the glomerular filtration rate, or GFR, which measures how well your kidneys filter blood. In stage 1, GFR is 90 or higher, indicating mild loss of function with signs of kidney damage. Stage 2 is a GFR of 60 to 89, still mild but with more noticeable damage. Stage 3A, with a GFR of 45 to 59, shows mild to moderate loss, while Stage 3B, with a GFR of 30 to 44, indicates moderate to severe loss. Stage 4, with a GFR of 15 to 29, means a severe decrease in function. By Stage 5, with a GFR below 15 or requiring dialysis, the kidneys have failed, also known as end-stage renal disease, or ESRD. At this stage, dialysis or a kidney transplant is often needed to survive. Diagnosis of chronic kidney disease. How is chronic kidney disease diagnosed? Common diagnostic measures include blood tests to measure serum creatinine and calculate your estimated GFR, or eGFR. Urine tests check for protein using the albumin to creatinine ratio, or ACR. Values above 30 milligrams per gram suggest kidney damage. Imaging, like ultrasound or CT scans, can detect structural issues or obstructions in the kidneys. In some cases, a kidney biopsy is done, taking a small tissue sample to determine the cause and extent of damage. Regular monitoring of GFR, ACR, blood pressure, and other metabolic markers is essential for managing CKD over time. Early detection of CKD is key to managing it. Doctors often start screening if you have risk factors like diabetes or high blood pressure. Care and management of chronic kidney disease. Lifestyle changes, including adopting a low-sodium diet, quitting smoking, controlling weight, and staying physically active, are important in CKD management. Controlling underlying conditions like diabetes and high blood pressure is essential, often with medications such as ACE inhibitors, ARBs, diuretics, phosphate binders, or erythropoiesis-stimulating agents to address anemia. A renal dietitian can help tailor your diet to limit protein, phosphorus, potassium, and sodium. Mental health support is also important, as CKD patients often face depression, anxiety, or stress. Patient education on monitoring symptoms, sticking to treatments, and recognizing complications is key. As CKD nears end-stage renal disease, preparation for renal replacement therapy, like dialysis or a kidney transplant, becomes important. Early referral to a nephrologist and coordinated care can slow CKD progression and improve quality of life. When to see a doctor? See a healthcare provider if you have risk factors like diabetes, high blood pressure, or a family history of kidney disease. Be alert for symptoms like swelling in your feet or ankles, persistent fatigue, frequent urination, especially at night, blood in your urine, or high blood pressure that's hard to manage. Early intervention can prevent complications like cardiovascular disease, bone disorders, or anemia, which are common with CKD. Takeaway on chronic kidney disease. Chronic kidney disease is a progressive, often silent condition, but it's manageable with early detection and action. Understand your risk factors, watch for symptoms, and get regular screenings to check your kidney function. If you're at risk or noticing symptoms, talk to your doctor today. Early detection and treatment can slow CKD's progression, reduce complications, and help you live a healthier, fuller life. Visit lenstapesmed.com for more health information.